Signs your chronic cough may be serious. A cough that lingers for weeks can signal more than a simple cold. Here's when to see a doctor. Lasts more than 8 weeks. A persistent cough could indicate an underlying condition like asthma, GERD, or COPD. Bloody or rust-colored mucus. This might be a sign of infections or serious lung diseases, accompanied by weight loss. Unexplained weight loss with a cough may need immediate evaluation. Severe shortness of breath. Difficulty breathing could point to conditions like pneumonia or heart problems. Worsens at night or with activity. A cough triggered by lying down or physical effort could indicate heart or lung issues.